while we're there, let's kind of talk about kind of the treatment. So again, obviously what we've kind of been hearing is kind of like influenza. There's no direct standard treatment. So it's not like it's you can go take antibiotics for this. This is a viral infection. So in general, what we get is we provide kind of supportive care to help them get through it. And that supportive care kind of comes in a couple ways. So obviously we kind of talked about fluid and electrolyte replacement earlier. Also then kind of treating any of the complications of the infection. So kind of looking at things like if they're in any pain, we can help manage the pain. If they're nauseated, we can give them antiemetic medication to help them feel better. We can make them kind of feel better in terms of helping treat the fever. And then also kind of help with the coagulation. They may look at giving blood products or fresh frozen plasma to kind of replace any of the red blood cells or clotting factors that have lost. So one kind of interesting part that you may kind of note too is that you actually do start developing, obviously it's an infection, so you start developing some antibodies. So the IgM antibodies develop within 2 days, the IgG develop within 5 to 8 days. So, and that's actually kind of been one of the interesting treatments that they've been giving is the survivors that have survived this infection so far have basically been donating blood, and they basically spin it down, collect the plasma that contains the antibodies, and then use those antibodies and then give an infusion of the antibodies, or basically the plasma, to those that are currently under treatment for this. So, and the goal there is to kind of help jumpstart kind of the fight against the virus. One kind of thing that we haven't mentioned so far, but it's probably worthwhile, is obviously a lot of the signs and symptoms are very similar to some other diseases. So if folks are coming from West Africa, not only do you need to kind of think Ebola, but there's a lot of other stuff that Africa has, or diseases that Africa has that we don't. So malaria, cholera, dengue fever, those are other differentials to kind of consider as we go through our treatments and thought processes. Now, the big part is kind of the prevention. So again, there's no vaccines currently for it. So obviously there's no direct prevention for it. But basically kind of some of these same concepts that we've always kind of been talked about in terms of how do you kind of stay healthy, right? So frequent washing of hands, being aware of what you're touching. So once you're exposed, are basically kind of touching your mucous membranes after you've been around a patient. Making sure that everything is kind of clean, that you're wearing the proper protective equipment. Those are the measures that we kind of take. Again, kind of what you also heard is that the patients are being kind of isolated. So if they're coming back now and they're considered a higher risk, they will basically kind of quarantine them, isolate them. Again, they're trying to kind of make sure that they're limiting the patient contacts. So again, that's kind of the limit to direct contact with it. Part of, again, our first world practices, we're kind of aware as patients, we get introduced to patients. Certainly all the protocols now are basically kind of saying, if they're if they're running a fever, they're showing signs and symptoms of kind of influenza, we should start kind of asking them, have they been exposed or recently been to Africa, or been exposed to someone who might be carrying Ebola. And so we're starting to kind of take it. So, if they go into the emergency room, they're going to get these series of questions. They go into clinics, they're going to get these series of questions. And certainly we should be asking those questions as well. And then obviously we kind of talked about the care during the stay. And then obviously another part is we'll talk about, care after the patient dies, which that's actually on the next slide. So, but obviously the big thing is kind of these infection control measures and basically making sure that we are wearing the proper protective equipment. And we'll talk about those, and that we're actually kind of cleaning up after we're dealing with the patients. After death, and this is kind of one of in the U.S. we have kind of different burial rituals compared to kind of what's normal cultural practice or religious beliefs in Africa. We generally have very limited exposure to the bodies after death, where in Africa it tends to be kind of more of a group and family process in terms of how they're buried. Again, remember the virus basically can continue to spread for days or weeks after the body has died. So as long as that virus is kind of wet and moist, it's able to kind of keep transmitting it. So any cadaver, any animal that had this disease has a potential to transmit the virus. So part of it is basically kind of making sure that we're aware of that and that we're handling this well. As our healthcare providers go over to Africa to help them kind of deal with the outbreak, that's one of the practices that they're trying to kind of instill and get folks to think about, is that a lot of the traditional burial rituals may not be in the best interest of the entire family, because unfortunately the body still has the ability to transmit disease. And then kind of the last part, which we've kind of been talking about, right? So proper disposal of all the waste, and then ultimately that waste needs to be disposed of in a controlled manner. All right, we've kind of been talking about proper protective equipment. So there's 2 videos that we'll send out that's kind of correlates with this. It talks about basically proper donning, which is basically the putting on of equipment, proper doffing. Typically in EMS, we don't spend a lot of time on these topics as compared to some of our counterparts. So the folks that are, the surgical technologists, the surgeons, the nurses that work there, they spend a lot more time in practice and kind of making sure that that's done correctly. There's a certain way that you take on and put on and take off gloves that limit the transmission. We tend to just kind of take them off and kind of say, well, basically, there's a way to do it that limits the exposure, that limits to make sure that we don't splash this and get this on our skin and then later touch our eye or touch other stuff. So please make sure that you kind of watch those and kind of start thinking about that a little bit more, because as you take it off, if you take things off correctly, then it limits it. So kind of the intent here is basically everything on the surface has the potential to be exposed, and if we touch it with a clean hand, now we run the risk of contaminating ourselves. So the whole concept is that dirty touches dirty, dirty never touches clean, and so that's how we kind of try to make sure that we get stuff off. And the last thing that we'll kind of talk about here is basically kind of the draping of the ambulances and prepping of the ambulance. So if you kind of notice here that basically there's kind of drape. So this is Grady EMS, who is one of the agencies that transported some of the folks from Dallas to Houston. So these are the Grady's out of Atlanta. And so basically you can kind of see them here. They are prepping the ambulance and trying to get it ready, kind of with draping to make sure that, so after the patient has been in the ambulance, it kind of helps to limit the spread of fluids, limit the spread of the virus, and kind of does it. So this is kind of now standard kind of protocol within an EMS system. If there's a potential for an Ebola patient, this is one of the steps before we start transporting them, is that we kind of drape the ambulance to make sure that we are able to kind of help kind of clean it up a little bit better. So again, you can kind of see them here. They're wearing they have all the proper protective equipment as they get ready to kind of move the patient. So hope you have a great day or afternoon, and we'll talk to you soon. Thank you.